Hi, I'm Ping Ping. Thank you for tuning into Facebook Live. I'm from Home Nursing Foundation, and thank you for joining us today on this online video on medication safety tips. Some common question that always being asked: how do I manage all these medication that are coming from different doctors and appointment? Here are some tips to share. Step 1: always do a medication reconciliation. Compare all the medication that you have. Are they the same drugs, and what is the dosage? If yes, they are the same medication, and which one is near to expire and which one is later. Always start with the one that is nearer to the expiry date. If no, are there any old medication that are taken off the medication list? If so, make sure that they are discarded so that you always follow the latest drug prescription that you are given, and so that's to avoid any wrong dosing or wrong medication taken. Step 2: look at the storage label on the box and do as advised. If the medication is supposed to keep at fridge, then it should be kept at the lower compartment of the fridge and away from any food that you have. General rule of thumb: keep medication away from any direct sunlight. Keep medication in their original box and label to avoid any mix up. Keep them in a cool place as well. Keep them clean. Okay, step 3: be clear of what you are eating. Know what are the medication for and possible side effect of the medication that you're taking so that you can anticipate and respond accordingly. Always ask your doctors, nurses, or even pharmacy this question so that you can indicate on the box what are the medication for and what to anticipate so that you can be part of the management. Example, if you have blood pressure medication, there is a possibility of feeling dizzy on position change, and by knowing so, you can change the position slowly so as to allow your body to adjust. For diabetic medication, you can feel sometimes dizzy, palpitation, or even hunger, which is sign of low blood sugar, and you should then be able to respond when the event happens. Step 4: know what you want, know what to eat, when to eat them, which is clearly indicated on the label, and follow strictly. However, for some older person, this may be very confusing as they have many medication and there are changes to this medication from time to time. And they may even have difficulty in handling the pills, such as unable to break them through the pack, or even have eyesight problem that doesn't allow them to see clearly and administer the medication safely. So this is time where the family member, caregiver come in very handy to help them with the organizing of this medication, such as packing them into the pill box for them, and all they need to do is just to take out the daily dose for themselves. If none of you are able to do so, then as what Home Nursing Foundation are always being referred for, we have patients that are unable to manage their own medication or medication compliance. We have the nurses going in to do medication reconciliation and pack the medicine for them and record and report any adverse effects of the drugs. We can also share it with the healthcare professional, which then make this medication compliance and management much easier for the patient. Some asking me, if I don't take the medication, will it affect my quality of life? Okay, we can look at this question in two different aspects. If we are taking medication for chronic disease, like diabetes, hypertension, or even cholesterol, it is mainly to help us to get better control of our disease so as to reduce risk of complication and thus maintaining quality of life. For example, high blood pressure medication help to reduce the risk of stroke. Diabetes medication help to reduce organ failure, risk of amputation. For high cholesterol medication, it helps to reduce the risk of heart attack and stroke. And therefore, taking of all these medication will improve our quality of life by preventing this complication from surfacing much earlier. For medication that are for acute illnesses, for example, relief of cough, flu, and running nose, this medication is actually to help us to reduce the symptom of the discomfort. For example, you're taking antibiotic to treat an infection and antihistamine to reduce any allergy or running nose. And therefore, if we don't take this medication for acute illness, then we will feel sick for a longer time, we will suffer from the symptom, and possibly pose a longer risk for infecting others. So if I don't take medication, will it increase my risk of future diseases? Uncontrolled disease can run higher risk of complication, and therefore, as I mentioned earlier, hypertension can put you at risk of stroke, diabetes, limb pain, limb amputation, or even organ failure. Cholesterol can put you at higher risk of heart attack or even stroke itself. Many will be asking, are there simpler and safer options than taking medication itself? Well, lifestyle modification is the safest and is complement treatment. However, not all lifestyle alone can change the direction of the disease actually. So rather than taking it, we should take lifestyle modification as a complement to our treatment, so as to reduce the pill load, for example, keeping the dose of our medication low by continuing our good lifestyle. So eat healthy, exercise at least 3 times a week, at least 30 minutes each time, good stress management, and our current trend of hand washing, wearing a mask also keep us safe for a long way. For patients with high blood pressure, you can try reduce salt in your diet, no additional salt in your diet itself. For diabetes patient, no added sugar. The choice of carbohydrate also is very important. For high cholesterol patient, make sure that you don't have excessive oily food. The choice of oils used is also important. No animal fats, for example. Others asking, can I take medication? The easier way out, can I take medication and continue with my non-healthy lifestyle then? Well, if chronic disease are not well controlled, the risk of disease complication therefore become higher and can surface faster and may risk you from having a higher dose of medication or even need to use multiple drugs to just control the disease itself. So the choice is really yours. If you are worried about pill load, then make sure that you keep yourself well so as to reduce the pill load and keep the disease well controlled. So if I'm feeling better, can I stop taking the medication? Most of us would wish for that, but I would say do not stop until your doctor advises you so. As most people with chronic disease, they usually feel normal, and even when they are still with the chronic disease or when the complication is crawling up, they still feel normal most of the time. The better feeling may be also due to the use of medication, as it better control the disease, or even worse, the person can be in a state of denial, rejecting the illness and treatment that is given, and therefore they have the feeling of they are better already. Okay, you are encouraged to observe any side effect of your medication. If there's any difficulties in either administration of the medication, the dosing, or even the frequency of the dosage, your fear, your preference, it should all be shared with your healthcare professional truthfully so that they can help you in the choice of the treatment. Others ask, can I gradually reduce the dose or even stop it slowly? It doesn't make any difference. Let your healthcare professional partner do so for you. Always share with them what you think, and then they can explain to you what is the next plan or next step for you. Some actually ask me, is it harmful for me to take so many medications, so therefore I should reduce my own the number of medication that I'm taking? Well, your doctors actually have, before they give you any medicine, they have actually considered your organ function, your kidney, your liver, and your drug allergy status. They may even consider your drug-drug interaction as well before they prescribe you medication. Therefore, on your part, you should allow your doctor to know what other medication that you are taking, such as any recreational drugs, over-the-counter, or even Chinese medicine that you are taking. Many ask, is there any food restriction, drinks restriction that they should buy when they are taking medicine? Well, when the drugs are mixed with any food or drinks, there is a potential of increasing the action of the drug, decreasing the action of the drug, or even cause adverse side effect. And therefore, medication should always be taken with water only. Not beside the food, there are also other things that can interfere the drug's effect, such as use of other drugs I have mentioned earlier, any supplement that you are taking, and your current medical condition. Again, they will either increase, decrease the effect of the action of the drugs that you are taking or cause any adverse side effect. For example, if you are taking any sedation and you add on alcohol to it, you may be sleeping longer or even at risk of not able to wake up. If you are taking cholesterol medication, if you are taking grapefruits with it, it can increase your risk of muscle ache. For those that are on blood thinner, for example, if you are taking any rich in vitamin K medication, it can reduce the effect of the medication itself. So the disease is actually not limited to the example that I have given. Therefore, it is important and safest for you to ensure you have shared all this information with your healthcare professionals and seek their advice. I was asked what kind of beverage can or cannot be taken together with medication. Mentioned earlier, medication is best taken with water where it has neutral effect on the drug itself. And how should this, when should we take the beverage that we prefer? Again, at least a half an hour interval will be good. Okay. Can I continue with my medication, or can I take my medication even though I'm on my vitamins already? The answer is yes, but you should share this information with your healthcare professionals so that they work out the math for you, whether there's any drug-drug interaction before you continue. Okay, so to help yourself is to make sure that your healthcare professional understand your preference, what you are taking, and then we can work together as partner to make things work better for you. Let's see if we are getting any question from the... Okay, so have a good day. We are done today and see you next round.